while the world fights to get coronavirus under control, the death toll soars in Spain as hospitals become more overwhelmed. I'm Imran Garta, and today on the Newsmakers, we go to Europe to look at the impact of COVID-19 in Spain. What emerged in China just a few months ago has quickly spread across the world, affecting almost everyone's lives. In Europe, millions have been forced to stay home as the virus ravages the continent, killing thousands. Italy has been the worst hit, but not far behind is Spain. Perhaps we haven't heard as much about it, but in the month of March, the death toll went from 0 to 9,000. The Spanish government has imposed a lockdown, hoping, like so many other governments, to flatten the curve. Now, while the foreign minister has said the outbreak appears to be slowing, each day hundreds are dying. Stretched beyond capacity in one of the continent's best healthcare systems, medical workers are doing all they can to save patients' lives. But as Haider Abbasi reports, most feel like they're fighting a losing battle.
Bringing out the dead. The emergency ward of this hospital in Madrid can treat 60 patients. But it has more than 600, and they're all suffering from COVID-19. Hospitals across Spain are similarly overwhelmed. The country is rapidly becoming the new front line in the battle against the novel coronavirus. More than 8,000 Spaniards had died by the end of March, the second highest death toll in the world. So why is the virus spreading so fast here? Spain's government has been criticized for acting slowly and not taking the outbreak seriously. At the start of March, it had recorded only 84 cases, but by the time a lockdown was imposed 2 weeks later, more than 6,000 people had tested positive. And at the end of a month, this rose to nearly 95,000. That's more than China, where the virus originated. Just a week before Spain imposed restrictions on public life, large outdoor events were still being held, such as this rally on International Women's Day, attended by 120,000 people. And like Italy, Spain has a significant elderly population. According to the World Bank, nearly 20% of people here are aged 65 or above. Out of a population of 47 million, that's more than 9 million who are most vulnerable to the virus. It seems Spain's healthcare system can't handle the outbreak.
A lot of people leave their shift crying. They feel powerless and frustrated because they can't properly look after the patients.
Doctors have complained that there aren't enough ventilators, masks or protective equipment. After a decade of spending cuts, Spain's hospitals have been left under-resourced. Medical supplies have come from China and NATO allies. But there's been a problem with coordination. Although Spain has a national health service, its 17 autonomous regions manage it independently. This has led to extreme inequality in the way hospitals are managed. And like other countries, Spain hasn't been testing enough people for the coronavirus. Last week, the government sent back 58,000 rapid testing kits to China because they gave inaccurate results. Applauding medical staff is becoming popular among all countries hurt by COVID-19. But if hospitals are constrained by resources, there are only so many lives they can save. Haider Abbasi, The Newsmakers.
Well, let's go to Madrid now, where I'm joined by José Antonio Lopez Guerrero. He's a microbiology professor at the Autonomous University of Madrid and is currently working to find a treatment for COVID-19. Luis Arroyo was an advisor to former Socialist Prime Minister José Luis Rodríguez Zapatero. And Cristina Manzano is the editor-in-chief of Esglobal, an online global affairs publication. Really good to have you all on the Newsmakers. Cristina, let me begin with you. The numbers are really bad, both in terms of infections and deaths. Could it have been preventable with better leadership?
Well, that's a very tricky question because we cannot predict the past. We can only analyze what happened, and it was very, very difficult. Nobody really knew the importance and the magnitude of this catastrophe. So I wouldn't like to answer in those terms. The government did what the World Health Organization was advising to do. Now we can say yes, it reacted late. It could, all the measures could have been taken earlier, but really we were not enough aware of what was going to happen. And yes, for instance, you were showing images of this footage of these demonstrations and of all the gatherings that took place just before the lockdown. That could have been avoided, and we as citizens could have been more responsible, saying, I know this may happen, I won't go. But this, again, it's unfair. I repeat, we were not aware of the magnitude of this catastrophe.
Right. Jose Antonio Lopez Guerrero, when you heard Dr. Fernando Simon on February 9th say Spain will only have a handful of cases, this is the head of medical emergencies in Madrid. Obviously, this comment hasn't aged well, and I'm not here to embarrass the leadership, but were they complacent? Did they underestimate what was going on? Where did they go wrong?
Yeah, first of all, I have to apologize for my rusted English. Today is not my best day. I have some fever because I am since last 6 days with symptoms of the coronavirus. But
we hope you don't have it. We hope you feel better.
Thank you. Anyway, I completely agree with Cristina. It's very, very easy to predict the past. But anyway, I really think that Spain reacted against the virus earlier than the rest of our neighbor, for instance, France, Germany right now, or even United Kingdom. But anyway, many things could be happen in a different way. But the problem is that we are right now here. We have to be responsible. We have to row in the same direction, all the country, in order to try to avoid the spreading of the virus.
Right. And so the Spanish healthcare infrastructure and the Spanish healthcare system, sir, is fantastic. It's one of the best on the continent. Despite that, well, yes, despite that, it's overwhelmed now, right? So help me understand what can be done better right now in the emergency that Spain finds itself in right now from a medical perspective.
I'm not a physician, I'm a virologist. Yes, is obviously our hospital are completely collapsed, but nobody could predict the speed of the spreading of the virus. What could really do right now? I think we are acting in the most important epicentric zone like Madrid or even in Catalonia. We are contracting many spaces, new spaces for thousands of new patients. And really, I don't know, we have to be here in this precise moment until a new treatment could appear. I really don't know what we could do better right now.
Right, and we've spoken to many people who are working on a form of treatment, whether in Silicon Valley, in San Francisco, or where you are in Spain. Just before I go to Luis, Jose Antonio Lopez Guerrero, how is it going in terms of trying to find treatment for this? Tell me about that process.
Yes, in Spain, several dozen of projects are carrying out right now. In my own laboratory, we are trying a new biopolymers which work very, very efficiently in vitro. We hope we will be able to try in mouse model in a few months. But anyway, there are several combinations of previously tested drugs against another virus, for instance, against HIV virus or Ebola, which combined used to work because used to stop the polymerase and the replication of the virus. And this is the reality right now. Until new specific drugs are completely proof and already in therapy, we have to recover previously combined drugs that at least is already ready to be used.
Right. A lot of people looking to sort of mix and match, and from what we're hearing,
Yes.
it could take many months, as early as September or October. There's no consolation for, a little consolation for a lot of people around the world. Luis Arroyo, are you worried?
Well, of course, we all are worried about the situation, but my preoccupation is more for other things that are happening in the world. Just to add something about what Cristina and José Antonio said. Spain has taken probably the hardest measures in the world. We are all in quarantine. The lockdown of the country is basically total, except for very essential industries. We seem to be, hopefully, we seem to be at the peak of the curve right now. The situation is getting better. We are just behind Italy in terms of time. The contagion has been very hard. We have to take into consideration that fortunately, we have the highest life expectancy in the world, which means that we have the oldest population. That means very much for the explanation of the data. Just take a look at what the United States or some other countries in Europe have said and have done, and you will probably measure our government in a better way than some people is.
Yeah. So, Cristina, especially since you have access to a multiplicity of views across the political spectrum and a lot of different Spaniards with different perspectives, do they all accept that we're at a point now where this is most possibly the peak? And as the foreign minister and Luis and others say, it's going to get better now, and that the number of infections are going to be slowing, and we're going to see the effects of lockdown start to come to fruition over the coming days and weeks?
Well, that's what we all hope, really. And what the figures tell us is that the increase in the number of people infected is decreasing. The amount of people infected every day, the percentage is decreasing. That doesn't mean that there are not many people going to the hospitals. But for instance, I was reading this morning that people going to emergency rooms has been cut for the last week. And yes, if we reach the peak, these days at the end of March, beginning of April, we all hope that this begins to stabilize. You were asking before what can be done, and I would like to stress one thing. For instance, the fact that we in Madrid, we were able, thanks to the emergency unit belonging to the army, to set up a hospital, an emergency hospital with more than 5,000 places for patients. I mean, that is something that we can do, and we need to make that work better, but things are being done.
Right.
The other space for improvement is coordination. You also mentioned in the introduction that we have one country, one state, but we are almost a federal country with 17 different regions, and each of them manages its own health system. We should improve coordination among all of us, and that would also improve the collection of figures and the treatments and so on. But yes, we all hope that we are really seeing the peak, and that more and more, we are also receiving more sanitary and health material coming from other countries, and all those measures will help to deal with this situation in a better way.
Right. Luis, as somebody who has worked in politics and understands Spanish politics better than most, how difficult is it to get that coordination across all the 17 different autonomous regions, especially given that over the past few years there's been a lot of division, whether it's about the Catalonia vote or whatever it was? How difficult is it to get that coordination?
Well, right now, to my view, is working more or less in political terms. Probably not as much as we would like in terms of the intervention, but politically, the country is basically united supporting the president. Basically, that doesn't mean that there are no differences. Of course, for example, Catalonia again. Did its opposition role, but basically the country is more or less united relating to the regions. I cannot say the same with regard to the political differences between parties in Spain. The opposition is being very, very tough with the government, especially in this last week. There was a beginning 2 weeks ago in which the whole country seemed to be united against the virus, etc. But right now, it's probably another phase in which political differences among parties, etc., is probably sounding higher.
Right.
But basically, the differences between regions, I would say that in political terms, we cannot see them probably except for the Catalanian politics that is always itself.
Right. Jose Antonio, I want to come back to something that you said earlier when I said it's one of the best healthcare systems on the continent, and you said it was. What was the turning point for you? At what point did Spain go from one of the best to maybe not one of the best anymore?
Sorry, I could hear you.
When I asked you earlier, when I
Sorry.
mentioned earlier that it's one of the best healthcare systems on the continent, you said it was, right? So what was that turning point for you? Where did it go wrong?
Yeah. Yes, certainly. I think Spain has been one of the best country in the world around the healthy about the health. But since the last crisis we have 10 years ago, I think we've lost a lot of the opportunity to increase the public funding in investigation and in clinical treatment and in clinical care. I think really we could be better than in fact we are being right now.
Christina, the fact that a lot of healthcare workers didn't have what they call PPEs, the personal protective equipment and so on. Who can you actually blame when it comes to that? Is there a specific figure that you can turn to and say it's your fault?
Again, we will tend to blame the health authorities, but we could not foresee this. Having said that, it's true that we've been hearing about this since January. We've been following the news from China. Probably we did not react quickly enough to get all that equipment. And then when we did, we found that half of the world is fighting to get that equipment, also in China and in other places. So the place to blame is always the health authorities, because they are the ones who have to buy this equipment or to make sure that the equipment is in the hospitals and the sanitary centers. But it is a very unknown situation for all of us, for all the world. And I think this is going to be one of the main lessons, that we need to be better prepared for whatever crisis may erupt in any given moment.
Luis Arroyo, it seems quite likely, not just in Spain, but everywhere around the world, that lockdown will continue for longer than was initially stipulated. This virus is not going away anytime soon. How much can Spain actually cope with that lack of economic activity, with lockdown tumbling from weeks to months, maybe for many months?
Well, some economists are saying that this could be a V, that this is not really a long-standing, that this could probably not be a long-standing crisis, that we could just freeze the economy for a while, and then probably the activity will come back. That's the most optimistic view, of course. The second one is that this is going to have enormous economic consequences for our economy, which is based, by the way, in tourism, services, etc., that are all stopped. It's not only a matter of shutting down the country. The matter is how our borders are going to be open again for tourists, how our tourism activity is going to be rebuilt, how our services are going to work again as they did. So probably the effects on our economy are going to be tougher in that sense, that Spain is a service and tourism economy, not only, but basically but basically it is. And so probably the effects will be tougher than those economists are suggesting. Who knows? We are now confined until April the 14th. We don't know if the government is going to prorogue that more time, or we will be coming to the streets again and rebuild this very happy land based in the life in the streets and receiving people, etc.
Yeah, Jose
so
Antonio,
consequences are probably harder for us.
Right, Jose Antonio Lopez Guerrero, for those people who are itching to go out again and who feel as if maybe in April or, well, we're in April already, but maybe later in April or maybe in May, they can go back to resuming normal life. Is there a harsh reality facing them that this might be much longer?
Yeah, is the hot point, is the most important question right now. I really don't think that this is going to happen like that. In a few weeks, we can return to our normal life. Obviously, we can see what is happening in China. I think at least we will have with the restriction of movement in Spain, at least 1 more month. After that, what will happen, I don't know. It depends on the course of the curve, and it depends on how it's going with the contagion. But anyway, I think the new measurement after this quarantine should be taken with very carefully. And I really don't think that before the summer we will have completely movement capacity.
Yeah, and that's something we're hearing from a lot of experts from a lot of countries. Cristina, do the vast majority of people accept that this is probably going to be a long battle and that they're not going to be able to go out to restaurants in 2 weeks' time and enjoy life as per normal?
I think we have mixed feelings. I think most people wish we could go out in 2 weeks when the lockdown is officially announced. It's over. But I also think that most people are very aware that this will take longer. And in any case, that when it is over, it will be gradually over, that we won't recover normality as we understood, as we used to understand normality in a long, long time. For instance, talking about tourism, I assume the sector already knows that we won't recover all those tourists from many other places. Also, even if we recover normality, they won't. They would have reached the point where we are in a month, in 2 months times for the summer. So the sector is hoping, is counting on domestic tourism. So, if with this time we cannot go to the Caribbean for our holidays, we will go to the south. But as I said, it will be certainly a gradual thing. We won't recover normality as such from one day to the other.
Luis Arroyo, for those people, and I'll give you the example of the country I come from, South Africa, right? South Africa's also been under lockdown for about a week now. With the army on the streets and the police on the streets, some rebellious souls, not many, but some, say this feels like apartheid, this feels like the old days, right? Is there something similar among some rebellious spirits within Spain who say this feels like the General Franco days, being locked down, we need to be free?
There are some voices that are saying that we have to be very careful with certain rights that we have, the right of free expression, the right of course, of meeting others, of reunion, etc. All those rights are already limited, and there are some voices that are suggesting that the government should be very careful to the extent of its decisions. Right now, there's people is behaving very well in general terms. There are some cases, some exceptions, but people is behaving very well. All of us are in our houses. There has been no public alarms, no public expressions, etc. But there are some voices, small voices, that are saying that we have to be very careful with all that war metaphor that we are in the middle of a war, so we have to call the army, etc. Some voices are saying, be careful with that. We can understand, but be careful,
Yeah.
I would say.
Yeah, it is a monumental challenge for everybody around the world. I mean, this is the first time I think for a lot of us, we've been involved in talking about a story that quite literally affects every single continent, every single country in the world. Nobody has a solution, and nobody knows exactly how to tackle this, and that's why it's been a pleasure just getting your differing perspectives on this issue. We wish you all the best. We wish Spain all the best in its battle against COVID-19. Jose Antonio Lopez Guerrero, Luis Arroyo, and Cristina Manzano, I thank you very much for joining us here on The Newsmakers. And thank you for watching The Newsmakers. We will see you next time.